Dr. Stepovich, a dentist, an orthodontist like you, is obviously known to straighten out teeth, and the average normal dentist, just go and make a good smile, and that's all wonderful. But how does orthodontic work, straightening out the teeth, how does that affect the facial structure? Not just this smiley, which is super important, we know that. But how does it affect the rest of it? Caved in cheeks or lips not working correctly and basically, all that stuff. Maybe even looking crooked. I don't know. Tell us something about it.
I think we can start out by talking about the anatomy of a smile. How do you, an orthodontist are working with the smile to make it proper and have the teeth in the right position when the patient opens their mouth, to have the teeth in the right position. All of us have seen patients or people who smile and they show a lot of gum tissue instead of teeth, and the orthodontists call it a red smile. In orthodontic treatment, we move the teeth up into the bone, and now when the patient smiles, it shows some teeth rather than a lot of gum tissue. So the anatomy of a smile requires that you put the teeth in the proper place for that person's lip structure and how wide they open their mouth. And we always talked about some movie star or something had a great big smile, and an orthodontist who would treat that patient would make sure that the teeth covered the whole opening in the mouth, so you wouldn't have dark shadows at each corner. So those are called dark shadows there. And the anatomy of the smile, you want to reduce that. And then you want the smile line to be exactly from when they smile, from the corner where the lips come together on the side, straight across there, that's where you want the teeth to be seen there. You don't see much of the lower teeth, but you do a little bit, and they even construct a smile in the lower teeth in the anatomy of a smile. So there are a lot of things that go on just where you position the teeth. Now, where you position the teeth also affects the soft tissue of the face. So you can move teeth, and you look at a profile of this patient, and their upper lip is ahead of the lower because the upper teeth are ahead of the lower, and the upper lip is forced forward. So if you do the treatment and correct that underlying support for the lips, now you created a better profile for that patient. And they really enjoy that. And no one really sees their profile unless they look at a photograph. And we take the photographs here, and so we compare what we've done with them, and when we have progress reports for the patient and during treatment, we show what we've done for the teeth and what we've done for the face. So we do that continually. So face and teeth go together for me, and on my business card it says orthodontist, dental facial orthopedist, and that's what I am. I treat teeth and faces and create great personalities in doing that.
In doing that. Well, it makes lots of sense. Obviously, the teeth, the cheek, everything is so interconnected that arranging one makes the other thing looking better. So basically, an orthodontist can be, especially for the adults. I mean, obviously for the children also, for the younger people. But for those adults, they might look at it as like, look, we're going to shave a few years of our life here on just the way we look on the face. Absolutely great. Absolutely great. Thanks a lot, Dr. Stepovich.
And I love doing this. That is one of the rewarding things about being an orthodontist. You change faces, not only teeth. Take